Good morning. My name is Demetrice Reeves, and today I will be presenting, my client staffing presentation. My client name is Kalia Richards. She is Black Latino. She's 35 years old, a female. Her living situation right now is that she's living in a drug rehab facility. What brought Miss Kalia Richardson in, Kalia Richards, in today is that she's seeking to regain parental rights and custody of her biological son. The identified problems with Kalia Richards. Miss Kalia expresses need for shelter. Miss Kalia is currently again living in a drug rehab facility, which is only temporarily and needs help with making stable living arrangements. Miss Kalia also has some symptoms of depression. She expressed that she was diagnosed with depression 6 months ago by a previous psychiatrist and is seeking treatment. Ms. Kalia's strengths related to the treatment plan. Ms. Kalia understands the process of her situation and is motivated to make the necessary steps to attain proper shelter and treatment for depression. Ms. Kalia has a job babysitting and was recently promoted to full-time with a pay increase. Ms. Kalia recently signed up for emergency housing and was informed she will receive a call for orientation within less than 3 months. Ms. Kalia is also currently involved in weekly group sessions for 1 hour in her current drug rehab facility. And her case manager, Ms. Regina Taylor, says that she's been very helpful in facilitating those groups as well. Ms. Kalia, group sessions consist of talk and behavior sessions, which focus on the cause of addiction. The group session has also helped Ms. Kalia with peer support. Ms. Kalia is also attending an individual therapy session with Dr. Brown for depression treatment twice a week for 1 hour. Dr. Brown says Ms. Kalia is very involved in their sessions and she has some improvement in her moods. Benefits of the therapy consist of decrease in reliance on citalopram, which is a depression suppressant, development of positive coping strategies, and emotional dependency. Ms. Kalia exercises for 30 minutes a day, which helps her relieve the stress, and attends church occasionally, where she has developed peer support as well from church members. Her ethical issue dilemma. Ms. Kalia currently has a pending no contact order pertaining to her biological son and is requesting access to his file. She has also required some information pertaining to the adopted family that consists of knowing their work location, where they're living, and also their phone number. Ms. Kalia states that she believes that this is necessary for her to visit her biological son so that she can become familiar with his biological mother and help begin the steps to developing a mother and son relationship. However, according to the NASA NASW Code of Ethics, social workers should protect the confidentiality of all information in the course of professional services, except for compelling professional reasons. In addition, Ms. Kalia is going to court to regain custody of her biological son. In this process, due to the circumstances, I am being ordered to go to court, and therefore I may have to be court ordered to share some personal information that's between me and Ms. Kalia. I believe that sharing this information may involve me and Ms. Kalia as far as trust. I believe that confidentiality is important to social worker and ethical principle in social work. Unfortunately, in this situation, due that the worker that I may have to break that rule due to the law that may require me to share personal conversations between me and the worker. The preliminary assessment. The problem selection is shelter, symptoms of depression. Ms. Kalia's strengths. Ms. Kalia is motivated and willing to go through the process of reaching her goals. Ms. Kalia has a support from peer group at current drug rehab facility. Ms. Kalia has applied for emergency housing assistance and attends one-on-one therapy weekly. Ms. Kalia has been drug-free for a year and cooperates in taking her medication, which is citalopram, daily. The goals here are to improve adequate living arrangements and learn to manage emotional responses. The evidence-based theory. The evidence-based theory to be used for the intervention is psychodynamic therapy. This is a treatment that focuses on recognizing negative patterns of behavior and feelings rooted in past experiences and resolve them. The treatment helps the individual freely express themselves, identify unconscious patterns of negative behavior or feelings, and how they've been influenced by unresolved past experiences. Through this treatment, the client can learn how to overcome these unhealthy behaviors. The intervention here would be the psychodynamic individual therapy. That is what's been recommended. The psychodynamic therapy is an intervention that includes a range of treatment for depressed individuals. Psychodynamic therapy tries to get at why you feel or behave. Brief summary. According to Jonathan Schilder of University of Colorado, Denver School of Medicine, psychodynamic psychotherapy form of treatment facilitates self-exploration, examines emotional blind spots, and understands relationship pattern. In addition, Schilder revealed that scientific evidence study shows that psychodynamic therapy is highly effective, and benefits of this therapy are as large and lasting as cognitive behavior therapy. Patients who receive this treatment not only maintain the benefits of treatment, but continue to improve after treatment's end. The diversity issue here is that Miss Kalia is Black Latino and was raised by her biological mother, who believes in discipline. Miss Kalia's mother taught her daughter the motto of "what happens in our home stays in our home," according to Miss Kalia. Miss Kalia have encountered several challenges due to this form of belief, but gradually is learning the difference between discipline and abuse. In addition to this, Miss Kalia's mother did experience the same discipline from her biological mother, which may be a reasoning for what Miss Kalia believed that may be a reason for why she's taking the same actions. According to the 2002 Journal of Counseling and Development, which focused on Latino and Hispanic families, Latino parents value closeness, dependence, obedience, family loyalty, and responsibility to care for all members of the family. Children are expected to follow orders, so their parents tend to be more strict. For this reason, it is important for children to be well behaved and represent the family with good morals in public. This has been my presentation for my client presentation for Miss Kalia Richards. At this time, if anyone have any questions, please feel free to ask me.
I'm asking you, and I'd like to know, why was a child taken away from her in the first place?
Miss Kalia, what your name again? I'm sorry.
Athleen.
Athleen?
Yes.
Okay. Miss Athleen, the reason why her son was taken from her in the first place, she was charged with abandonment because she was addicted to crack.
Okay.
Yes. At this time, does anyone else have any more questions?
Yes. My name is Devine Crooks.
Hi,
and
Devine.
Just curious in reference to when you mentioned that her mother, the whole discipline thing, she was abused because that's the way her mom actually, grew up, I guess.
Well, her biological, Miss Kalia Richards, which is the client, her mother abused her, but her mother also was abused. Miss Kalia Richards' mom was abused, which would be Miss Kalia Richards' grandmother abused her mother.
So this is why, so the abandonment was just what, because you said what, because she was on crack? She was on drugs?
You're talking, which,
in reference to why her child was taken away?
her child was taken away because she was addicted to drugs, but being addicted to crack caused her to be abusive towards her child.
All right. So, okay.
Yes.
I just wanted to be sure.
No problem. Thank you so much for asking those questions. Again, this is Demetrice Reeves. This is my client presentation on Miss Kalia Richards. I hope you enjoyed the presentation and have a wonderful day.